Hi everyone, this is a detailed video about brain tumors. Well, a brain tumor is a mass or growth of abnormal cells in your brain. Many different types of brain tumors exist. Some brain tumors are non-cancerous, benign, and some brain tumors are cancerous, they are malignant. Brain tumors can begin in your brain. These are known as primary brain tumors, or cancer can begin in other parts of your body and spread to your brain as secondary brain tumors. These are known as metastatic brain tumors. How quickly a brain tumor grows can vary greatly. The growth rate as well as the location of a brain tumor determines how it will affect the function of your nervous system. Brain tumor treatment options depend on the type of brain tumor you have as well as its size and location. Well, earlier on this channel I have already uploaded a short video about brain tumors. I hope you have already seen that video, and today I am going to discuss this illness in detail. Well, just remember that I am discussing brain tumor in general because there are so many types of brain tumors. Well, first of all, let me tell you the symptoms. The signs and symptoms of a brain tumor vary greatly and depend on the brain tumor's size, location, and rate of growth. General signs and symptoms caused by brain tumors may include new onset or change in pattern of headaches that gradually become more frequent and more severe, unexplained nausea or vomiting, vision problems such as blurred vision, double vision, or a loss of peripheral vision, gradual loss of sensation or movement in an arm or a leg, difficulty with balance, speech difficulties, feeling very tired, confusion in everyday matters, difficulty making decisions, inability to follow simple commands, personality or behavior changes, seizures, especially in someone who doesn't have a history of seizures. Also, there may be some hearing problem. Well, you should make an appointment with your doctor if you have persistent signs and symptoms that concern you. Now I'll tell you the causes of brain tumors. First of all, let me tell you about brain tumors that begin in the brain. Primary brain tumors originate in the brain itself or in tissue close to it, such as in the brain covering membranes. These are known as meninges. Cranial nerves, pituitary gland, or pineal gland. Primary brain tumors begin when normal cells develop changes, mutation in their DNA. A cell's DNA contains the instructions that tell a cell what to do. The mutations tell the cells to grow and divide rapidly and to continue living when healthy cells would die. The result is a mass of abnormal cells which forms a tumor. In adults, primary brain tumors are much less common than are secondary brain tumors, in which cancer begins elsewhere and spread to the brain. Many different types of primary tumor exist. Each gets its name from the type of cells involved. Examples include gliomas. These tumors begin in the brain or spinal cord and include astrocytomas, ependymomas, glioblastomas, oligoastrocytomas, and oligodendrogliomas. Another type is meningiomas. Well, a meningioma is a tumor that arises from the membrane that surround your brain and spinal cord. These membranes are known as meninges. Most meningiomas are non-cancerous. Acoustic neuroma, also known as schwannomas. These are benign tumors that develop on the nerves that control balance and hearing, leading from your inner ear to your brain. Pituitary adenomas. These are tumors that develop in the pituitary gland at the base of the brain. These tumors can affect the pituitary hormone with effects throughout your body. Medulloblastoma. These cancerous brain tumors are most common in children, though they can occur at any age. Medulloblastoma starts in the lower back part of the brain and tends to spread through the spinal fluid. Germ cell tumor. Germ cell tumors may develop during childhood where the testicles or ovaries will form, but sometimes germ cell tumors affect other parts of the body such as the brain. Craniopharyngiomas. These are rare tumors and they start near the brain pituitary gland, which secretes hormones that control many body functions. As the craniopharyngioma slowly grows, it can affect the pituitary gland and other structures near the brain. Now I'll tell you about the cancer that begin elsewhere and spread to the brain. Secondary brain tumors, also known as metastatic brain tumors, that result from cancer that start elsewhere in your body and then spreads metastasis to your brain. Secondary brain tumors most often occur in people who have a history of cancer. Rarely, a metastatic brain tumor may be the first sign of cancer that begin elsewhere in the body. In adults, secondary brain tumors are far more common than are primary brain tumors. Any cancer can spread to the brain, but common types include breast cancer, colon cancer, kidney cancer, lung cancer, and melanoma, which is a skin cancer. Now I'll tell you some risk factors. In most people with primary brain tumor, the cause of the tumor is not clear, but doctors have identified some factors that may increase your risk of a brain tumor. Risk factors include exposure to radiation. People who have been exposed to types of radiation called ionizing radiation have an increased risk of brain tumor. Examples of ionizing radiation include radiation therapy used to treat cancer and radiation exposure caused by atomic bombs. Family history of brain tumors. A small portion of brain tumors occurs in people with a family history of brain tumors or a family history of genetic syndrome that increases the risk of brain tumors. Now I'll tell you about the diagnosis of brain tumors. Well, if it is suspected that you have a brain tumor, your doctor may recommend a number of tests and procedures, including neurological exam. A neurological exam may include, among other things, checking your vision, hearing, balance, coordination, strength, and reflexes. Difficulty in one or more areas may provide clues about the part of your brain that could be affected by a brain tumor. Imaging test. Magnetic resonance imaging is commonly used to help diagnose brain tumors. Sometimes a dye is injected through a vein in your arm during your MRI study. A number of specialized MRI scan components, including functional MRI, perfusion MRI, and magnetic resonance spectroscopy, may help your doctor evaluate the tumor and plan treatment. Sometimes other imaging tests are recommended in certain situations, including CT scan and positron emission tomography, that is PET scan. Then we can collect and test a sample of abnormal tissue, that is known as biopsy. A biopsy can be performed as part of an operation to remove the brain tumor, or a biopsy can be performed using a needle. A stereotactic needle biopsy may be done for brain tumor. A stereotactic needle biopsy may be done for brain tumor in hard to reach areas or very sensitive areas within your brain that might be damaged by a more extensive operation. Your neurosurgeon drills a small hole into your skull. A thin needle is then inserted through the hole. The tissue is removed using the needle, which is frequently guided by CT or MRI scanning. The biopsy sample is then viewed under a microscope to determine if it is cancerous or benign. Sophisticated laboratory tests can give your doctor clues about your prognosis and your treatment options. Now I'll tell you about the treatment. Well, treatment for a brain tumor depends on the type, size, and location of the tumor, as well as your overall health and your preferences. The first treatment option is surgery. Well, if the brain tumor is located in a place that makes it accessible for an operation, your surgeon will work to remove as much of the brain tumor as can be done safely. Some brain tumors are small and easy to separate from the surrounding brain tissue, which makes complete surgical removal possible. Other brain tumors cannot be separated from surrounding tissue, or they are located near sensitive areas in your brain, making surgery risky. In this situation, your doctor removes as much of the tumor as is safe. Even removing a portion of the brain tumor may help reduce your signs and symptoms. Surgery to remove a brain tumor carries risks such as infection and bleeding. Other risks may depend on the part of your brain where your tumor is located. For instance, surgery on a tumor near nerves that connect to your eyes may carry a risk of vision loss. The second option of treatment is radiation therapy. Well, radiation therapy uses high energy beams such as X-rays or protons to kill tumor cells. Radiation therapy can come from a machine outside your body that is known as external beam radiation, or very rarely radiation can be placed inside your body close to your brain tumor, that is known as brachytherapy. External beam radiation can focus just on the area of your brain where the tumor is located, or it can be applied to your entire brain, that is known as whole brain radiation. Whole brain radiation is most often used to treat cancer that spreads to the brain from some other parts of the body and forms multiple tumors in the brain. Traditionally, radiation therapy uses X-ray, but a newest form of this treatment uses proton beams. Proton beam therapy allows doctor to control the radiation more precisely. Then another option is radiosurgery. Well, stereotactic radiosurgery is not a form of surgery in the traditional sense. Instead, radiosurgery uses multiple beams of radiation to give a highly focused form of radiation treatment to kill the tumor cells in a very small area. Each beam of radiation is not particularly powerful, but the point where all the beams meet at the brain tumor receives a very high dose of radiation to kill the tumor cells. There are different types of technology used in radiosurgery to deliver radiation to treat brain tumors, such as gamma knife or linear accelerator. Radiosurgery is typically done in one treatment, and usually you can go home on the same day. And another treatment option is chemotherapy. While chemotherapy uses drugs to kill tumor cells, chemotherapy drugs can be taken orally in pill form or injected into the vein, intravenous route. The chemotherapy drug used most often to treat brain tumor is known as temozolomide that comes with the name of Temodar. Other chemotherapy drugs may be recommended depending on the type of cancer. Chemotherapy side effects depend on the type and dose of drug you receive. Chemotherapy can cause nausea, vomiting, and hair loss. Tests of your brain tumor cell can determine whether chemotherapy will be helpful for you. The type of brain tumor is helpful in determining whether it is recommended to have chemotherapy or not. Targeted drug therapy is another option. While targeted drug treatment focus on specific abnormalities present within cancer cells. By blocking these abnormalities, targeted drug treatment can cause cancer cells to die. Targeted therapy drugs are available for certain types of brain tumor, and many more are being studied in clinical trials. Your doctor may have your tumor cells tested to see whether targeted therapy is likely to be an effective treatment for your brain tumor. Then we must consider rehabilitation after treatment. Because brain tumor can develop in parts of the brain that control motor skills, speech, vision, and thinking, rehabilitation may be a necessary part of recovery. Depending on your need, your doctor may prefer you to physical therapy. Your doctor may refer you to physical therapy department. This physical therapy will help you regain lost motor skills or muscle strength. Occupational therapy can also be done. That will help you to get back to your normal daily activities, including work after a brain tumor or other illness. Speech therapy with specialists in speech difficulties, speech pathologist, to help if you have difficulty in speaking. Then for the school age children, tutoring can be done to help kids cope with the changes in their memory and thinking after a brain tumor. Well, this was my video about brain tumor. I hope you liked this video. If you have any questions about brain tumor, let me know and I will try to reply to your comments as soon as possible. Thanks for watching this video. See you in next video. Bye for now.